I'm Eleanor Smith, I'm Director of Nursing and Quality at NHS Grampian, and really pleased to welcome you to this briefing session this morning. We've got a short presentation to provide, and then we'll just open it up for questions. But before we do that, I'll just introduce a few more people, or get a few more people to introduce themselves. Sharon?
Good morning, my name is Sharon Duncan and I'm the Employee Director for NHS Grampian.
Good morning, I'm Susan Webb, I'm the Acting Director of Public Health.
Good morning, I'm Johnny Stephen, Clinical Governance Coordinator.
And over on my left.
Neil Strachan, Divisional General Manager for Division 5.
Okay, so thanks everyone for introducing yourselves. We'll just move on to the presentation, and if Janice could put on the first slide, that would be great. And just most people will be familiar with this, but just to let you know that there are 3 reports coming out today. There's the report from Healthcare Improvement Scotland, there's the Older People in Acute Hospital report, and there's the Royal College of Surgeons report. So this presentation is going to highlight a few themes from each of these, and then we'll, as I say, we can discuss what the key messages are. So just by way of background, Aberdeen Royal Infirmary, there's been a short life review of quality and safety. March, a small group of senior consultants raised a number of issues with the Cabinet Secretary, and the Chief Executive, Richard Carey, commissioned a validation exercise. And then following that, NHS Grampian invited Healthcare Improvement Scotland to have a detailed review of leadership, culture, behaviours, etc. And quite a lot of you would have been involved in that, around the services, particularly around emergency medicine, general surgery, obstetrics and gynaecology, and critical care.
We should say that there will be handouts available at the end, so you don't actually have to make notes off the slides.
And actually we would encourage you to share the handouts with your staff that couldn't be here this morning. A review team was established, 11 members in that review team, chaired by Dr Angus Cameron, who is the Medical Director in Dumfries and Galloway. And again, lots of you would be familiar with that, the 3 visits. They spoke to about 530 staff, probably felt like about 1,000 at the time, but it was 530. NHS Grampian had to submit a substantial amount of evidence, but as well as that, the review team looked at national data. There was a medical engagement survey of all the medical staff and some senior management in Aberdeen Royal Infirmary, and the review team looked at feedback from patients and patient groups. The review team also looked at 32 consecutive complaints records. They looked at the case records of 49 patients who died within 30 days of admission. They looked at 13 adverse events in their management, and then there was the unannounced inspection of the care for older people that took place in ERI and Wood End in October. So I'll leave you a minute or so to read that, although you won't be able to read that at the very back, so sorry. It says here, we are extremely grateful for the openness of staff throughout the review. It is clear that most staff spoken with had a sense of pride regarding Aberdeen Royal Infirmary, but felt very concerned about the prevailing leadership, culture and operational difficulties that were eroding both the hospital's effectiveness and the goodwill of staff. We're also grateful for the experience of patients and carers in describing their experiences. It says patients achieved broadly similar outcomes in ERI compared to similar patients in other Scottish hospitals. We find dedicated and hard-working individuals, particularly those in frontline roles, who are committed to delivering the highest standards of healthcare to the people of Grampian. The patient outcome data didn't show consistent or widespread concerns about safety at ERI, and when viewed as a whole, the data do not highlight consistent or widespread concerns about the quality of patient care at ERI. So that's good news. It's saying the hospital's safe, that patient outcomes are good, or as good as they are across the rest of Scotland. They're saying that patient experience on the whole is good, and it's saying that our staff we've got really good staff that work hard. If we go into some of the other findings, it highlights issues around leadership and culture, and is quite explicit, is saying that there's been weaknesses in leadership, in the management of the board, the executive team and the senior management team in respect of ERI. It highlights that a number of consultants have acted to undermine management and have exhibited poor behaviour, a small number, and that there are very poor relations between some medical staff and management at all levels. It goes on to talk about governance and accountability and highlights that some areas are weak in that and need to be improved. In terms of staff governance, this would be no surprise to anybody in the room, it highlights that there are considerable staffing difficulties, particularly medical staffing within the emergency department, that require urgent attention to maintain safety. It highlights complaints management, that the leadership and management of complaints is poor, with evidence of defensiveness in some responses. So that was key findings from his review. In terms of the older people in the acute hospital review, it highlighted one area of strength, and that was in relation to Wood End. It highlighted that they have a person-centred approach, particularly at meal times. It highlighted 22 areas for improvement, which I think we would all agree makes hard reading and is really disappointing. It particularly highlights that the management of flow and capacity is not fit for purpose, that our discharge processes need improvement, and that documentation across nursing and medical requires a real focused improvement activity because of its inconsistencies there. Again, areas for improvement, particularly around flow and capacity, and highlighting that currently patient safety is not at risk, but the potential, if that's not addressed, is that it would put patient safety at risk. And senior nurse and medical leadership must regain the confidence of staff by addressing the issues of staff motivation and patient flow and capacity, which is difficult to hear that. And I guess one of the things we need to come on to is how do we support all our staff as we go forward. Then there's the Royal College of Surgeons of England report. That is the role and remit of the report is being published today, as are the recommendations, but the details around it aren't being published. But you would see there that the purpose of that was the Royal College of Surgeons were asked to consider concerns about the general surgery service with specific reference to standards of team working, standards of individual behaviours, the ways in which the surgical consultant's team was working, and individual behaviours that may or may not be impacting on the delivery of care and the quality of patient outcomes. And again, important to highlight that the report didn't highlight current issues of patient safety, but does in fact highlight a number of areas where improvements in culture and team working need to be addressed. So, yes, the review team found no information which suggested that the general surgical service was unsafe, but concluded that there were serious failings in the behaviour of several individuals and a dramatic breakdown in team working in the department. So it's got 29 wide-ranging recommendations, including about review of individual cases, follow-up care, restructuring, behaviour, and job planning. So some of the things that are happening today and have happened a little bit of yesterday. The interim chief executive, Mr. Malcolm Wright, has provided a message for all staff, which is on Globals and on our intranet. There's a media release being prepared. It's on the Global email, and we do have hard copies available if anyone can't access emails. There are copies of the 13 recommendations from his report available. The full reports are on the intranet and the public website, and I'm not sure anybody had a chance so far to look at the reports this morning. Yeah. They came about out at 9:30 this morning. the HIS brief, we've got copies available, and again, it's on the website. We're doing staff information sessions, and there are staff support and drop-in sessions, and you would see that again from what's on our internet pages. And the chaplaincy service is happy to provide a listening service for anyone who feels they want to discuss that with the chaplaincy service, as they're well used to listening to in difficult situations. So that's really the end of our presentation, and it's just really over to yourselves to ask questions, further clarification, have a conversation about this. Realise too that this is really difficult to hear things, so understand that it might take people a little while just to accommodate what they've been hearing.
The reports are uncomfortable reading. You will recognise the recommendations. You will recognise many of the difficulties that we know we've had, that we've been trying to tackle. Some of the things are ongoing that we're trying to tackle, such as recruitment in medical, nursing and HPs. And some of them are things that perhaps hadn't touched on you particularly, but you might have been aware that they're happening. But whatever, when you read about it being your own organisation, it's not a nice thing to do, to read that the organisation you work for has failings that now need to be addressed. As someone pointed out to me earlier this morning, the experience that we have from other boards that have gone through a similar experience, NHS Lanarkshire, they had their report over a year ago, and they have implemented their action plan and their recommendations, and they are moving forward. And I suppose once you read the reports and you hit where you hit in terms of your own personal rock bottom about them, the only way is up, and we're going to have to move forward together to solve some of the problems that we have within NHS Grampian, within resources that we have. There is no indication at this stage that there will be a flood of resources coming NHS Grampian's way in order to solve this. So the solution is going to have to come from each and every one of us. The Chancellor of the Exchequer announced 2 billion to go to the NHS. Well, by the time you divvy up that into what Scotland's share of that 2 billion is, and then the 10% of Scotland's share that is NHS Grampian's, it will not solve all of our recruitment problems overnight. A lot of our recruitment problems are not financial based, but are in fact difficulty in getting people to come to the Grampian area and the cost of living that's here. And we recognise that, we openly recognise that, and we are tackling that as best we can. If anyone has any ideas for recruitment that they think we're missing, please let us know and we'll try.
I just want to say that Sharon's absolutely right in that there's no additional resources going to be flooding into Grampian. But our Director of Finance and others have been working really hard with the government to accelerate our NRAP formula so that within the next 2 years we'll be within 1% of our NRAP formula. So that's really helpful, and we know that we will have additional resources next year, and we know that already some of that has been highlighted for being used for clinical staffing.
A number of papers are being published today, the action plan of how we move forward to come out of this. There's a briefing going around each and every patient around ARI, and that was started distribution first thing this morning to reassure patients that the services are safe and to apologise for the disruption that will be caused by the media in and around ARI. It may well be that there are television cameras in and around ARI. It's a public site, they have the right to stop and ask people questions, but it's up to individuals whether they choose to answer the questions that are there. That's up to individuals. Most press inquiries, however, will come through corporate communications and should be dealt with accordingly.
Anybody got any observations or questions or thoughts?
I like to think that the reaction won't be entirely negative. I haven't read the report, obviously. I would think that a lot of it won't be surprises. I don't expect to see lots of surprises in there. And it's been a struggle working here for a fair amount of time, and possibly increasingly so. So I anticipate this is the start of something better,
Mhm.
to be
Yeah.
honest.
Yeah.
And I'm not mindlessly optimistic. I don't
Yeah.
think it's going to be easy. I don't think that the report then leads in a direct line to the improvements that are requested or demanded from the report.
Mhm.
So I don't think we'll succeed in everything,
Mm.
but we all need help, and I think this is part of that process. So I think it's a good thing.
I think
I might
that's
change
really.
my mind once I've read it, of course.
I think that's a helpful thing to say, and there are good things in the reports, but they take a little bit of finding. But one of the things I think we do need to really stay focused on is they're all saying our hospital is safe. They're all saying that patient outcomes are as good here as they are anywhere else, and better in some instances. They're also saying that our patient experience is good. 96% of our patients say that their experience is good or very good or excellent. And they're all saying that we've got committed staff that work really hard. So these are really positive things to hang on to. We've just been joined by our chairman, Mr. Bill Houghton. So, morning, Bill.
Morning,
We've
Anna.
just gone through our
Apologies, I've slightly held up.
no problem.
Thank
We've
you.
just gone through our presentation,
Sure,
and we're
please.
just
Oh, sorry.
we're just opened up for questions and comments and thoughts.
It's tough reading. You know, none of the report, as you're saying, none of the report will come as a total surprise to people who are reading it, who have been aware of the difficulties that we've been struggling in. But when you see it in stark black and white on a computer screen or on a piece of paper, then it is stark reading. Stark reading. And I think you have to focus on that report and the action plan to see if one matches the other, and start a dialogue to let us move forward.
Yeah. Could you summarise the action plan and the main points for those of us who haven't read it?
While Sharon's looking for her papers, in terms of the action plan for his report, there's quite a lot of actions around our leadership and governance. There's quite a lot of actions around clinical engagement, and a lot of people here would be aware of that already through work that's happening with the advisory structure. There's a number of actions around waiting times and treatment time guarantees, and a lot of actions around staffing issues, particularly in the emergency department. So that gives a brief idea of some of the areas. Did you want to add to that, Sharon?
Sorry, I'm sitting here panicking because the action plan is 15 pages long,
sorry.
and I'm trying to scan read it to kind of give you a flavour, because it's under various headings. So thank you to Diane for that.
One of the key actions is moving very quickly to stabilise the acute sector structure, because there is a view that there's quite a lot of temporary posts and interim posts, and a view that needs to be stabilised and that needs to move forward at a pace.
I think if I aim for the bits in italics, it'll probably help, otherwise it's going to sound a wee bit like a sermon. We will ensure that we evidence and demonstrate our commitment to listening and responding to feedback from patients, and a culture of learning and continuous improvement is embedded across services. That's the first aim that we're going for. We will agree, communicate and implement values and behaviours which will establish a positive and constructive culture of respect, dignity and innovation, and robustly tackle personal and professional behaviour that is not consistent with these values. We will ensure that effective leadership is established within ARI, with clarity around structure, roles, responsibilities, and a sharp focus on the scrutiny of performance and risk mitigation. Nursing and medical staff and management will have equal responsibility and accountability for performance, patient safety and staff governance. There then goes on a number of headings under performance and planning, workforce, staff engagement, accountability, and then it breaks it down even further into some of the actions that go. So there's headline statements which you will recognise as strategic statements, I, for one, am always a wee bit doubtful about strategic statements until I see the detail that goes underneath them. So this report, which, as I say, is 15 pages long, and you won't thank me for reading it out loud, will go into some of the detail that will follow. What we're not looking for is recriminations against staff. Can we make that very, very clear? That we're moving forward together. We need now a period of stability to build on that stability to go forward. So when you do read the whole report, we are not out with hound dogs trying to track down individuals in any way, shape or form. What we are looking for is sustained improvement in NHS Grampian and what we need to put in place to achieve that.
However, I think if people have read the report and read the action plan and think there's something missing or something that hasn't been picked up, then do feel free to pass those suggestions either to your manager or to staff side representatives, because we are keen to hear what people have to say about how we can improve.
That's very helpful, Susan. Yeah.
Just a comment more than anything else for me. It's, you know, the press, I know they're going to be quite tough in the next few days, but are we assured or coming out any reassurance that they won't be too hard on some bits, you know, because the staff, at the end of the day, the staff on the ground are the people that can feel it rather than that are actually at different levels, actually, they're actually going to be facing with the public.
We've had a few months of ordeal by press.
Yeah, no, that's what I'm saying.
You know, that has done us no favours. Can we give you an assurance that the local press in particular are not going to be difficult? Then no, we can't guarantee that. If we go by previous press coverage of the local press, then it does tend to be more undermining than positive towards NHS Grampian. However, if you take the 14,000 staff that are in NHS Grampian and you multiply that by 4 for one member in every nuclear family, there are an awful lot of families out there that are directly affected every time NHS is criticised for its staff. Then when you count the patients that rely on the care that NHS Grampian provides, then you're talking about the whole population. So it's really about getting Grampian as a whole to get behind the NHS service that it provides within Grampian and getting the message out that the care is safe. We've got our difficulties, we know we've got our difficulties, but our care is safe and we're doing the best we can, and where we are not doing our best or as good as we could, we're going to rectify that.
You know, I think that's a very good question, and I mean, for my sins, I was a journalist. I worked for the P&J many years ago before I was in the public service, and I survived it. But yeah, I think it is going to be difficult. The next few weeks will be very, very difficult, and I don't expect much quarter from the press. I'll be quite honest with you. But I think what we've not to forget is, and I think it's been touched on before, is that Eleanor and Shan have touched on patient safety. I mean, that, to me, that is one of the key messages. And at the end of the day, while there'll be criticism about governance and the way we do things internally, and I take responsibility for that, I think a lot of people in Aberdeen City and Aberdeenshire will look at the aspect of patient safety and get some assurance from that. And the other thing they'll look at, and they'll know, especially those people who've come in and have an experience of ARI or any other part of Grampian, that this is a world-class service delivered by first-class people. So all I would say to you, I'm not going to pretend it isn't going to be very difficult for the next day or two, maybe a week or so, but come the turn of the new year, the press will have other things to focus on. So we will get through this. Well, I'll not get through, I've resigned, so I'm going. But I'm not going until the end of this month, December. Now, I've been chairman for 3 years, and I was on the board before that, so I've been on the board for 7 years all told. And I have to say, people have asked me, you know, you're going through a tough time at Grampian, and I say, yes, we are having a tough time. But there's never been a day in 3 years but I live down near St Cyrus, so I come up in the train every day. I've never once thought, I don't want to come to work for NHS Grampian, because I know perfectly well that we have an outstanding staff who are committed, and just keep your heads up and we'll get through this. I can assure you we'll get through it. And I didn't want to go until the end of the year because I wanted to see the HIS report, and I wanted to come to meetings like this, and my colleagues and I will be doing that over the next few days. If people ask me about NHS Grampian, I can tell them I'm proud to have been chairman. And you should be proud too, because you're the people that matter, not people like me or people on the board. You're the frontline people who deliver the service, and that's the interface that's important, vital for Grampian. So take courage from that. Stop buying the paper for 2 or 3 days if you like. just focus on it. And I know it's difficult, but you've really got to try and see this. This is a bad picture we're at the moment. But in this great scheme of things, we'll move on. We'll all move on. I'm moving on too. I'm going to have a long Christmas holiday. Okay, I want it, but I'm going to have it. So I really, I've come here as much as to say to you, what you have done, what you will do, is important. That's what's important in NHS Grampian. Thank you.
Are there any other questions? Okay.
Don't want to cut this off. If anybody's got any other questions or things they want to say or discuss, but equally don't want to keep people back if there's other things they want to get on and do.
If you can, go back to your place of work and share the message as widely as you can that we will get through this, that the care is safe, and that we're going to be supporting staff through this. That's why we're doing the briefings, the stuff on the intranet, making all the papers available, making everything and getting it as wide and as quickly wide as we possibly can. I think I'm in these until about 8 o'clock tonight. So, we are trying our best to get that out. For further support, as we've already outlined, the chaplains are providing a listening service that will be based in Forester Hill House. They're full-time reps. He's shaking his head.
Jim's shaking his head.
In the department.
It's within the department. I apologise for that. The staff side reps will certainly be based in Forester Hill House. If you want to come back to one of the further briefings, you're very welcome to come back. If you want to contact anybody through staff side, management, please contact us. Get in touch. Don't leave a question burbling away there that is not answered, because if we can't answer it, we'll find the answer for you and get back to you.
So thank you very much for coming, and as I say, listen to what our chairman says. You've got a lot to be proud of, we've got a lot to be proud of, and it's onwards and upwards.
Thank you for coming.